Hey everyone, I'm Dr. Jacobson, your go-to board-certified plastic surgeon right here in sunny Beverly Hills. Buckle up because in my practice, I've seen it all. From jaw-dropping transformations to some truly unforgettable procedures. It's been quite the journey and I can't wait to share it with you. Join me on the Beauty Blueprint, where we'll dive into cutting-edge procedures and techniques in the world of cosmetic plastic surgery and explore everything you need to know about the overall health and wellness. But that's not all. I've lined up some exciting guests who will share their insights on various aspects of health and beauty, making every single episode packed with valuable information and fun discussions. So grab your coffee and get ready to join the conversation every Sunday morning at 7:30 a.m. right here on Go Country 105. You won't want to miss a moment. Happy Sunday morning, Go Country listeners. We're happy to have you back again with us this week. If you're a new listener to the Beauty Blueprint, welcome to the show. We are here on Go Country every Sunday at 7:30 a.m. I'm your host, Dr. Joshua Jacobson, your beauty architect, and I'm here with my co-host, Heather, who's also my patient coordinator.
Hey guys, happy Sunday. It's a beautiful day today. Today we're going to be talking about a very sensitive subject for some. Is perfection attainable when it comes to plastic surgery? Some of you may say yes, but let's get into it and see how it unfolds.
Sounds good. Heather, before we delve into it, do you consider yourself a perfectionist?
I do. I am a perfectionist.
Yeah, I've seen that, which is good for me because you do a perfect job in the office.
Thank you very much. I like to think about, from A to Z, how many steps are involved, how much time is that going to take. I'm very operational. So if you're very operational, you typically tend to be a type A. Mm-hmm. I'm definitely a type A. I like organization, and I absolutely consider myself a perfectionist.
Yeah, all of the things you said is pretty much what I think about in the operating room. So you're a surgeon in the office.
Yes, absolutely. You're operational surgeon.
Yes, yes.
And how about you, Dr. Jacobson? Are you a perfectionist?
Yes, too much. I know it can get exhausting, but when I'm at work, definitely I want it to be. But then when I'm at home, it gets a little bit too much.
Yeah, it can be hard to turn it off sometimes, right?
It definitely.
Yeah. I've experienced that for sure.
Well, Heather, you're an esthetician by training, right? So what do you consider is the definition of perfection?
Yeah, that's a really good question. Having been an esthetician for a very long time, I was also a trainer and an educator. And so perfectionism is mandatory to train multiple people, especially when you're at scale, right? So really my definition of perfection is there's really one way to do it, and this is the way that it's done. And so by setting that example and showing, the people that you're training or you're educating, or even patients, right? Like, there is one way to do this. That's kind of how perfection lays for me, but I think it's different for some, right? Mm-hmm. Everybody has their own unique individual experience of what perfection means to them. So, Dr. Jacobson, what is perfection to you?
So perfection in the realm of plastic surgery, and then there's like in real life. So in real life, perfection means just attaining the best that can be. And same with plastic surgery. But perfection can, as we know in a regular life also, perfection is never achievable. It's always a goal, it's always a destination, but it's never something that we expect to get to.
Right.
And that's, I think, something that people sometimes forget about when they come to get plastic surgery. They think, okay, it needs to be perfect, but a lot of times they don't even have a definition or something in mind as to what that is. Our job in plastic surgery is to improve and to go towards perfection, but which means to make it better.
Right. Yeah, that's so true. It's so important to have realistic expectations, right? And the person that's performing that procedure, to have them help you really identify what those realistic expectations are. So, sometimes patients come in and they'll have a consultation and their expectations are maybe a little bit unrealistic, right? So it's our job to help them understand what those realistic expectations are, because we want you to have the best result and we want you to have the healthiest expectation.
Yes,
right?
exactly, which is very important, the mindset in plastic surgery. And, perfection and also beauty is very variable between people, in people's minds, and also in different cultures. So, for example, a lot of patients come in and say, I want natural looking breasts. And I tell them to bring inspo pictures. And what some of them think it looks natural is completely different than what some other ones think or what I think. That's why it always helps me to get into their mindset to see what they see from their eyes, what's natural, what's perfect, what's too big, what's too small.
Right.
And those also change with times and with trends and with cultures. For example, hundreds of years ago, being overweight was a good thing because that was a symbol of money.
Right.
Right?
Yeah, the more you ate, the wealthier you looked, or the wealthier you were, right?
Exactly.
Yeah.
And now it's become kind of like the opposite. You want to look as skinny as possible. That's the thing to be. So they change with time. Or for example, 15, 20 years ago, the overdone look was what everyone was looking for. For example, in the 90s, all women wanted kind of like the Pamela Anderson look of the breasts.
Right.
And about 10, 15 years ago, everyone wanted the Kim Kardashian butt and hips. But now they don't want that exaggerated look, and they want it more natural, more proportional.
Right. Yeah, and I think that that's so important to not ebb and flow with those trends, right? Because trends will change.
Yes.
And just like you mentioned, like sometimes some of those procedures maybe have more of a dramatic effect visually, right? That may be something that you have to undo later on, or you'd have to resculpt and reshape, and that can be costly, right?
Yes.
So it's best to just have a holistic, healthy understanding of your body, and your plastic surgeon is going to help you understand that and to have a realistic expectation, because you need to think 10 years ahead, right? You need to think 20 years ahead. So when people get these butt implants or things like that, or these huge implants, well, that might be out of style in 10 or 20 years. So that's something you have to think about.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
We've seen a lot of patients coming in asking for their buttocks to be reduced because they got a very oversized BBL, which is Brazilian butt lift, fat transfer to the butt. And now they want it to be smaller because they feel like it's too big, it's too noticeable, it's too unnatural. And now undoing that, it can actually be a little bit harder than actually doing a BBL.
Right.
I have a lot of patients who are in their 50s and 60s, and they're coming in wanting smaller implants, or they want their implants completely removed. And those are all completely different surgeries.
Yeah, that's amazing. So what about some technological advancements? So what are some different technologies in plastic surgeries that helped us to improve results, and what are the limitations?
Yeah, sure. So, with the advent of Botox and fillers, now we've been able to treat and prevent wrinkles, whereas before we weren't able to do that as well. Or, if you got a lot of wrinkles, we just had to wait until you accumulate a lot of them and then do like a chemical peel or laser. But now we're able to use Botox to prevent some of those wrinkles and leave some of those drastic procedures for later in life. Fillers have been really instrumental in improving some of the facial asymmetries. Everyone has some asymmetry in their face. It's inevitable.
Yeah.
And a lot of it is the size of the bones on each side of the face, and also the size of the fat pads. So we're able to use different fillers with different properties and replace some of that volume that's deficient in one side compared to the other.
Right.
So those have helped give us some tools to better achieve symmetry and sort of get closer to perfection. Also, fat grafting to the face. A lot of times now we transfer a little bit of your own fat to your face when we do a facelift, because with time you lose some of that facial fat. And transferring that fat gives you a very youthful face. Microneedling has been really instrumental, especially radio frequency microneedling. You've seen, ads for Morpheus. That's one of the brands, and that helps a lot with resurfacing, skin tightening. You're an esthetician, so yeah, you probably have a lot of experience, either your clients or yourself, with these technologies.
Yeah, absolutely. We typically work hand in hand with an RN or a plastic surgeon. And I would always tell my clients, okay, I'm going to put you on this regimen. I want you to pass this along to your plastic surgeon.
Yeah.
When you see them on Tuesday, or I want you to pass this along to your nurse, your RN, because I want us to make sure you have a very solid experience and that we're taking care of everything, right? Your skin, the volume loss in the face, right? All these things. And a lot of times for estheticians, we're dealing with patients who pre or post have or have not yet had a facelift. And so a lot of times, we have to communicate with those plastic surgeons to be like, hey, when can we realistically get back to their regimen? Because she comes in like clockwork every 2 weeks, or they come in like clockwork every 4 weeks. So when can we start doing those peels again? When can we start massaging? When can we do lymphatic drainage in the face? So they all work together. So it's really, really important that as a really good therapist, that you're communicating in covering all those key angles, right?
Yes, absolutely. Yeah. That's very important. Well, I'm glad I have an esthetician here.
Yes.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
Heather, can you tell me some of the more non-invasive, less invasive things that can be done by estheticians?
Yeah, absolutely. So one of the things that I think makes the biggest impact in the skincare treatment room is chemical peels. I think for people, I myself have struggled with acne like my entire life, and I cannot live without things like my salicylic acid or my glycolic acid or my retinol combos. So that's been a very, very big thing for me, and that's something that I think in the treatment room you need to get into if you aren't into already.
Yes,
Yeah.
That's very true. Those resurfacing treatments are very important. Also, retinol creams like tretinoin and
Yes.
hydroquinone, those are very, very helpful. One of the pharmacies that has a really good creams for acne and skin bleaching and skin resurfacing is Beverly Hills Concierge Pharmacy.
Yes.
On Brighton.
Yes.
They have some of the best creams. We've used them. We love them. I don't know what they do with their formulation, but it's really magic.
Yeah, Dr. Jacobson, you guys gave me a few, but some samples to try, and I was hooked. I was struggling so bad because I actually had a CO2 treatment done, and I had it done over 1.5 years ago. And it's so much time has passed by, but what that did was it triggered an acne outbreak in me that resurrected from the depths of hell, and I could not settle it. Right?
Yes.
And so that does happen. And it's something that if you have acne, you should be aware of because it can resurrect it. Dr. Jacobson gave me this tretinoin cream that was a combo. It was hydroquinone, tretinoin, what else?
And
Hyaluronic acid.
And also a steroid to decrease some of the inflammation.
Right. And so you definitely want to make sure you talk to your doctor before about the regimen, but it worked fantastic. My skin has been so much better. Thank you so much, Dr. Jacobson.
Of course.
Yeah.
I do encourage all of our listeners to call Beverly Hills Concierge Pharmacy. Their phone number is 424-335-0755. That's 424-335-0755 to inquire about these creams. You can also call our office and ask us about some of these treatments, and we can guide you to the appropriate treatment. Heather is going to be very helpful as well. Our phone number is 424-465-3800. That's 424-465-3800.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Now, Heather.
Yeah.
Talking about perfection, and I think you had mentioned that you've had procedures before. Now, what was your mindset in terms of perfection? What you were expecting and what you actually got after your procedures?
Yeah, no, that's a great question. I had a breast augmentation a long time ago, and so when it was time to take them out, or I decided to take them out, I was already kind of familiar with, like, okay, you're not going for perfection, you're going for a realistic expectation. So I feel very lucky in the sense that I already had that kind of knowledge, pre-procedure going into it. But anytime you go in under the knife or you go into a surgery, and I always tell all our patients this, like, you go through all those psychological thoughts in your head all over again. And so as much as you feel prepared for it, it's inevitable. So one of those things that comes up for me is this gonna look like this, right? We bring in like our pictures that have a certain look, and that's just to kind of give us a goal and an idea. But then you put yourself in that position and you're like, am I gonna look like that? How close to that am I gonna look? And looking at your before and after photos and constantly comparing it. So yeah, that's just something that I go through, and it's important to minimize that effect because you really wanna have a realistic expectation, and it's the healthiest outcome.
Yes,
right?
Yes, absolutely. That's very important. And that kind of gets us to the psychological factors associated with plastic surgery, and one of them seeking perfection and having body dysmorphic disorder. And just to give a little background, body dysmorphic disorder is defined as you viewing your body and your body's imperfections as out of proportion to what is actually there. So you may, for example, have a little bump on your nose, but you feel like your nose is half of your face, or you have a little bit of fat in your belly and you feel morbidly obese. So those are that's obviously a psychological problem, and that needs to be dealt with the help of a trained psychologist. And we try to filter that during our consultation. If you feel like you have body dysmorphic disorder, plastic surgery will not help you. It will only make things worse, because surgery is not perfect. It will not get perfect, and it will give you scars. And you will say, well, I thought it would be perfect, but now I have a scar and I'm not perfect. I'm better, but not perfect. So that can actually be harmful to get surgery in those cases.
Right, absolutely, yeah.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
So let's talk about some surgical limitations, right? So some of the physical limitations of the human body and how they affect surgical outcomes, no procedure can achieve an exact replica of an idealized image, right?
Right,
Yeah.
exactly. So patients bring Instagram pictures or filtered pictures of people of jawlines and snatched necks or snatched waists, and they say, "I want this."
Yeah.
A lot of times their body frame does not allow us to give them those results. They may have really narrow hip bones, and as much as we can improve things, we just can't achieve certain outcomes. And you gotta ask your plastic surgeon to be honest and frank with you, because I've seen some of the plastic surgeons just take your money and say, "Oh yeah, sure, we'll make you look good," and lo and behold, it's been a few months after surgery and you have not gotten the result that you were expecting.
Right.
And that's because there's only so much we can do with surgery. It's not like shaping a clay.
Right, right. Yeah, I think a lot of people ask when they call in or like when they have their consultation, right? I feel very boxy. And can I achieve what I'm seeing on Instagram, right? Like these ways. First of all, I tell people all the time, you guys, don't believe what you see on social media. It's a lie.
Yes.
And a lot of times, right, like people use those apps to minimize their waist and to make things look smaller, or we figured out ways with our phones and our cameras to flip it over and turn it to the back, and to make it look a certain way so that there's perception and depth. That's all good and fine and dandy, and that's okay too, but I always tell people what you might be seeing might not even be her real waist. So don't
Yes.
compare yourself to it, right?
Absolutely, yeah.
Yeah.
And a while back, I posted this video of someone that was showing how they could make it look like they have larger butts or larger hips just by the way they're posing it and what they're wearing.
Yeah, exactly.
Yeah, and sometimes even our own colleagues, plastic surgeons, they have patients after surgery have those poses that they didn't have before surgery, and it just accentuates and exaggerates the results. And those are just not honest results.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
You know, chin liposuction has become very popular these days because everyone wants that snatched jawline.
It has, yeah.
Right? And especially because nowadays you have filters that you can use to give yourself that look. And then people all of a sudden say, well, if I can look like that, then why would I just get plastic surgery and look like that? But
People come in actually asking to look like their filtered version.
yes, exactly,
Right.
which is completely unrealistic. To a certain degree, at least it gives me an idea of what they're looking for, and I can tell them, yes, that can be achieved or not. So that is good to bring, but just know that it's not always achievable. I had a patient who got chin liposuction and buccal fat removal, and she had good results. And then a few months later came in and said, I'm not happy with my results. And I was trying to figure out what it was. And I said, well, what were you expecting? So she showed me a picture of her 10 years ago when she was like 30 pounds lighter, and it was filtered, and I'm like, well, who is this? She's like, that's me. I'm like,
wow.
that doesn't look like you. You know,
Yeah.
you look completely like a different person.
Yeah.
And I told her, if you had shown me that before surgery, I would have told you that's not achievable.
Right.
Yeah, and then
Yeah.
she was unhappy. So then I had another patient who's actually a TikTok influencer, and she also same thing. She wanted a chin liposuction, and I told her, you know, there's only so much that I can do with the results that you're gonna get. And you know, depending on where the hyoid bone is, your thyroid cartilage, your neck anatomy, you might not be able to get a super snatched look. You can get it improved. I can take away the fat that there is there, but I cannot remove your muscles and glands, you know, because those just will harm you. So and she had very realistic expectations, and I actually was surprised with her results, but and she was very, very happy. But I think setting the realistic expectations early on was very, very helpful in her actually getting results that she was happy with.
Awesome. Yeah.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Let's talk a little bit about the role of aging, right? So I think it's interesting because I love that aging is becoming more accepted. We live in a very fortunate time where that's being more culturally adapting, right? Or adaptive.
Yes.
And I think that back then, even 5 years ago, 2 years ago, it was so not okay,
Yes,
right,
that's
to
true.
age. And we were etching out, right, like any fine line. And now it's like, show the lines, show, right, your smile lines or your laugh lines. Like that's something that is very much a part of your character.
Yeah.
So I love that that's being adapted to much more nowadays. But yeah, tell me a little bit about your thoughts on that.
Yeah, and that kind of goes along with what we talked about earlier about everyone tending towards a natural look and
Right.
more of a looking themselves. So, and it's fortunate because I'm sure you've seen a lot of women who've had facelifts and they have that Joker face, you know?
Yes, right.
And that's because they were being overdone and overpulled. And that shows you that, there's only so much we can do. And if we try to push it too much, things can get ugly. And nowadays, with people being accepting of a little bit of imperfection, a little bit of signs of aging, that allows us to stay within normal limits and not try to push things to a level that will give you really unnatural results.
Right. And you know what? You brought something up that I think is so important because it's another reason why you need to go to a good plastic surgeon who knows what they're doing and who has the results and the before and afters to really speak to that as a testimony, right?
Yes.
Because a lot of plastic surgeons that are doing these facelifts, and as you said, like the Joker face, right? Or just there's just certain things that are just not done well because sometimes they're just pulling the skin on the outside but not reconstructing what's underneath on the inside.
Yes.
So it's a twofold, and it's something that has to be done very skillfully. And so when people call in and they're like, oh, I'm gonna get it done so cheap, it's gonna be like $3,000, or I'm gonna get my breast lift over here and it's gonna be $8,000, and just depending on what they're saying, right? I'm like, okay, just make sure that they're doing it holistically, inside and out, right?
Yes, exactly.
Yeah.
And yes, that's absolutely true. And it's important to talk about it as a journey rather than a destination, as a process rather than as a goal. So it's what we try to do is improve and make things better. That it's impossible to achieve completely something that's sort of like very symmetric, very exaggerated, or very polished, but
Right.
we can always make things better.
Right.
And if you go in with that mindset, you will be a lot happier
Right.
with your surgery.
And I think, as far as ethical considerations, I think we also really have an obligation in the industry to promote realistic results, right?
Yes.
There's an ethical duty that we have.
Absolutely, yes, and it's very important, and I hope more of our colleagues more of our colleagues stick with that. Wow. Time went by so fast, and it's time to wrap up. Well, thank you for tuning in, and I hope you have all enjoyed our show today. Make sure you tune in every Sunday at 7:30 a.m. on Gold Country 105 FM to learn everything you need to know about plastic surgery. whether you've had it done or you're considering having a procedure in the future. We have many more exciting topics we're going to be covering on air, and as always, if you have any questions or if you want to book a consultation, give us a call at 424-465-3800. That's 424-465-3800. And make sure to follow us on Instagram at Josh Jacobson MD. See you next time, same place. I'm Dr. Joshua Jacobson, your beauty architect.